Good afternoon. I'm very delighted to be able to talk with you today on expanding nursing's scope. I want to thank Dr. Suzanne Kent for inviting me to speak with you all today. I have to apologize. I tried to get the video working and the file was too big to send, so I'm giving you a voice recording and you can see my picture there. It's a young picture of me, but nonetheless a picture. So let's get started. Well, we know that globally, nurses represent the largest occupational group of healthcare professionals in most countries. This is especially true in rural areas. So having expanded scopes would facilitate the reach of healthcare while also minimizing costs. And if we don't expand our scope of RN practice, there could be a lack of this could result in inefficiencies, gaps, and increased cost. These are some of the reasons why we want to think about this concept. So it's really important that nursing be the professional body to define our scope of practice. And this hasn't always been so in the past. Discrepancies and differences in the scope of practice of nursing have been based on organizational culture and resources in the past. That's, they've been driven by that. Evidence reports that regulatory and policy-based scope of practices vary based on geography. So if you live in a rural area versus urban area, you may have an expanded scope of practice. Or it can be varied based on your clinical geography. For example, this question always comes up, well, can nurses do protocol-driven care? And people get excited about that. But I always remind them that you have nurses in clinical intensive care units that are giving insulin directly into the vein of a patient who's in diabetic ketoacidosis. They are following a protocol there. So it varies by geography as well. And then, of course, organizational policy can vary and reflect different scopes of practice for nursing. So this can depend on the amount of physician availability. So especially in rural areas versus urban areas. So really, I want to come back to the fact that, in the past, we've let these other influences affect our scope of practice, but really it should be nursing to determine its own professional scope of practice. Now, healthcare evolves over time and changes. The complexity of healthcare grows. I don't know anybody who's graduated from a nursing program and not increase their skills and knowledge continually over their lifetime. That is our mission as healthcare workers. And so our scope of practice needs to evolve over time as well. And how we change and add to that scope of practice as individuals within the profession is by allowing for formal evaluation of knowledge, of continued knowledge. So this could be in the way of a certification process where you go and study on your own and then pass a test to do more and expanded duties, or we have competencies. I'm sure you have them as well. So they delineate what you would do in a certain circumstance for more advanced skills within the profession. So these are very safe ways to demonstrate expanded scopes of practice. The American Nurses Association has a broad definition of a scope of practice for nursing, and that entails the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. I think it's a lovely definition, but when we get down to where the rubber meets the road in individual states and individual practice, nurses are left saying, what is within my scope of practice and what is outside my scope of practice. So fine-tuning and drilling down to what they are allowed to do. So the different states within the United States, we have 50 states and territories, additional territories on top of that. You can imagine for the VA healthcare system for which I work, it's a veritable nightmare trying to figure out, we are the biggest healthcare organization within the United States. And for trying to figure out what our nurses can and cannot do in one state versus another is mind-boggling. And then having emergencies crop up like the COVID pandemic, it is another barrier for what our nurses can and cannot do. For instance, can a nurse administer COVID vaccines in the state of Ohio? Well, we don't know until we look up the State Practice Act scope of practice in Ohio. So there is a lot of variability. And then even if you look up the State's Practice Act, the scope of the board may remain silent on some activities for a nurse. So for instance, the Office of Nursing Services is interested in having one united scope of practice for all nurses across the United States and territories. And we have looked into individual states' scopes to compare what is allowed and what is not allowed. So you have liberal states such as Oregon and Colorado that allow a lot of activity for nurses. And you can look up in New Hampshire, for instance, I was involved in an activity looking up the scope of practice in New Hampshire. An LPN is noted to be able to suture. However, the board remains silent whether an RN could suture. So again, I'm guessing it's based on politics. The board couldn't decide on a vote. I'm not sure. So when the board remains silent, a nurse, for example, in New Hampshire would have to look at this algorithm. So these are often in many of the state boards' scope of practice. And there are things such as, is there evidence base for the nurse doing this activity? Is there policy procedures, protocols, competencies? Would a reasonably prudent nurse do the same activity? So you can see this is, this leaves a lot of room for interpretation, and the poor nurses are left not knowing whether they can and cannot do something. A lot of confusion, if you will. So, we need these broader scopes of practice for nurses in all areas. There is some literature in primary care, but we need this for general nurses, nurses in pediatrics. We need this for nurses in mental health. So for example, giving Narcan, opiate addictions are rampant. It's our other pandemic. So we need nurses to be able to give this Narcan by protocol, if you will. This is life-saving. Or patients with disabilities. The reach has to be far and wide. But in example, in primary care, there is evidence that nurses in primary care using algorithms and protocols can very successfully manage chronic disease. They can be team leaders and coordinate care. And that, especially in the United States, one of the barriers for nurses not doing this, and I have looked into this literature extensively, is that there's just simply a lack of reimbursement for these nursing activities. So that, of course, drives our healthcare system. But in the end, this is about the patient and patient outcomes, and this is where we are falling short. So you might be surprised to know that there are RNs prescribing, and this is actually a 2017 review of the literature that found 8 countries have nurses prescribing some form of medication. It might be birth control, who knows what it is, but you'll see that it's places that are needed. In some rural areas, Botswana, South Africa, Uganda, but even our very own Ireland, very proud of you guys, and United Kingdom. So there should be plenty of evidence, if this has been going on for a while, to ensure the safe practice and that we have competencies for nurses doing, and we have precedent for nurses doing this. I have another article I found from Ireland. Fealy and colleagues took a survey from the Irish Board of Nursing and asked their personal opinions related to expanding the RN scope of practice. So results showed that 93% of the nurses reported feeling motivated to expand their scope of practice. However, some barriers, 51% reported tension from overlapping scope of practice with other disciplines, and 57% had legal concerns, some of the same things we worry about here in the United States, and 31% had concerns regarding external body reviews. So I've spent the last couple years interested in such concepts as nursing compassion fatigue, burnout, and joy at work. And so it's really fascinating. As a profession, nurses want to feel that they're making an improved outcome for their patient, that having a sense of purpose and meaning at work is important to nurses, and autonomy is important for nurses. So, improving our work and improving outcomes is important to nurses, and we can't do that if we can't do what we are trained to do and competent to do. And if our tasks are minimized, we won't see the outcomes that we want to see for patients. So this all requires leadership training, communication skills, teamwork, and I showed you the survey from the Irish Board of Nursing, but there is some lovely evidence that these kinds of things help nurses feel autonomous and have joy and pride in their profession. So I really hope that what you've learned from this presentation is that the RN scope of practice needs to be flexible, comprehensive enough to respond to innovations in science and incorporate evidence. So science and healthcare are evolving. Nurses' roles will continue to evolve. And when you graduate from school, you may not have the skills that you need 10 years down the road, but there are competencies and training for that. And ultimately it's about delivering improved patient outcomes and improved patient satisfaction and safe care. And the bottom line is that, competencies need to be created by nursing and not by demographics or policy, or the percentage of physicians in an area. We need to be able to provide safe and reliable care and work to the top of our ladder of training and abilities. So I hope by now that I've given you some food for thought about an expanded vision for the scope of practice for nursing in the future. We here in the United States, in the Department of Veterans Affairs, are hoping to expand our scope and unify our scope across the United States so that we meet the challenging needs of our veterans and the evolving healthcare system. So we know that change is difficult, and nurses must create a guiding vision, take incremental steps towards that vision, and not lose heart when faced with obstacles. So keep an eye on what we're doing, and we hope to inspire other countries. And with that, I will end and wish that you all stay safe.